Good afternoon, everyone. Thanks for joining us today. I want to jump right in. We'll get right to the COVID-related numbers. Do obviously want to spend some time in a little bit giving you an update on weather conditions. We are preparing for what looks like a traditional weather event, a traditional snowstorm in the Mid-Hudson region, but certainly if you look at any of the mapping, we'll show you a little bit in a moment, talk about it in a moment, we are looking at a significant area of snowfall and a significant accumulation of snowfall. Jumping right in to COVID-related numbers, we have conducted 325,254 COVID-related tests. I do want to mention that Westchester Medical Center at Mid-Hudson Regional Hospital is expanding their testing capacity and access. So they're adding additional hours. This is just a reminder that Mid-Hudson Regional here in the city of Poughkeepsie is expanding that testing access. You do need to be pre-screened for an appointment. And if you'd like more details regarding that test site and all test sites, visit duchessny.gov/coronavirus testing, duchessny.gov/coronavirus testing. We are monitoring currently 1,321 active COVID-19 cases, individuals who've contracted the virus, currently 106 hospitalizations. Now, if you were following along over the course of the last 2 weeks, we're nearing 100. We dropped down to the high 80s. We are back up to 106. We have said this before. I will say it again. The trend is not sustainable. The hospitalization trend is not sustainable at this pace. And so we have to continue to take those steps necessary to protect your own health and the health of others. We encourage you again to sort of monitor your own health and to use those mitigation steps that we've talked about in the past, those protocols. Keep those gatherings small to individuals that are taking precautions, social and physical distancing when we're out and around to the extent it's possible, and wear a face mask. All of these things combined help to slow the transmission of the virus, and ultimately we hope not only bend the curve back on hospitalizations, but protect and protect your health and the health of others. And remember, monitor your own health. If you're not feeling well, it's not the time to head out. It's not the time to go off to work or to school. I know that those are challenging decisions that have to be made, but monitor your own health, engage in that personal hygiene, and if you know that you may have come into contact with or feel as if you may have contracted the virus, we do want you to head out and be tested. And if you feel like you have, begin to isolate yourself so that you're not transmitting the virus to someone else. So 106 hospitalizations. Just as a reference point, 2 weeks ago we were at 53 hospitalizations. At our peak we were at 108 hospitalizations. Also 2 weeks ago, 664 active cases. We've more than doubled that in the last 2 weeks. Our peak was 1,860 active cases. We know that the spread of the virus is occurring in these casual, mostly family-like settings among families and friends. So when you look at where the cases are coming from and the likelihood of continued growth, we have to be considerate now during the Hanukkah holiday. We're looking obviously a week now from Christmas, followed a week after by New Year's Eve. All of those are moments where if we choose to be a little bit more careful, to keep those groups small, to engage in the physical distancing, and to monitor our own health, we can slow that virus spread. And for us, again, the curve that we monitor the most is hospitalizations. If we can keep that if we can slow that rate of growth, we are in a better and stronger position, certainly not only for monitoring hospitals and keeping the hospital system functioning, but for our own health and the health of the people we care about. So you likely know, well, first I'll say, if you have a question, just type it in that comment section below the live feed. We'll get to as many as we can this afternoon. Already a couple. I'll get to those in a minute. Well, thanks. You're welcome. We always like nice compliments. Thanks for keeping people informed. We do appreciate it. Please share this information as we get along. Share it on social media so others have answers to some of the questions. We do want to mention 208 individuals have succumbed to the virus, and we are seeing, sadly, deaths occurring more regularly these last several weeks, and that's something to be very considerate of. In particular, we obviously extend our thoughts and prayers to those families who've been impacted. I certainly know the pain of losing a loved one, but I think it's also a moment to remind ourselves about how we express ourselves and the language we use and the way in which we interact. Yes, we can be frustrated. Yes, we should ask questions about the virus, but we also need to be very sensitive to the fact that there are people still that are getting sick, some very severe, and others are losing their lives, and families are broken apart because of it. So let's be sensitive to that. Kate asks about a plan. Has there been a plan to administer vaccines eligible for county residents? Great question. So the vaccination plan is already underway. You likely know that. Vaccines have been distributed across the country. New York State began vaccinations 2 days ago here in Dutchess County. We saw our first vaccines administered yesterday at Mid-Hudson Regional. I was there with Dr. Murtuza. And then a grouping of staff throughout Mid-Hudson Regional who were receiving the very first vaccines here in Dutchess. So let's talk a little bit about that. All right. So the Pfizer vaccine, approved by the FDA, began distribution. That is a two-step vaccination, 2 stages, right? A first shot and the booster shot. That is, in fact, what was being administered yesterday here and throughout the county. Secondly, Moderna has had their FDA approval to move forward with their shot. If I remember correctly, that's a single shot. So step one, phase one, is this, right? Phase one, higher risk healthcare workers already underway. Hospitals are the point of distribution. Hospitals will be administering vaccination to healthcare providers. That began. That is underway. Healthcare employees, phase one. And then second, from there will be nursing home staff and residents. All 13 nursing home facilities in Dutchess County are scheduled to have vaccines administered between now and the early part of January. So we expect that to occur, in fact, from now into the first 2 weeks of January. We have also pushed very hard for EMS personnel to be included in the early stages of vaccine and vaccinations. We are hopeful that the state allows that or moves forward with it. Now, EMS, we're always going to be early. We just don't think that it makes a lot of sense to have the men and women who'll be transporting individuals from their homes to hospitals or other settings not have been vaccinated, while those that are caring for them may well have been. So we want that all to converge with early vaccination. But again, to the question, yes, there is a plan in effect. County governments are responsible currently for sort of communicating information regarding the vaccine plan, making sure that the providers that are supposed to be out there administering, making sure that we know sort of the logistics, and that's, again, why we're coordinating with nursing homes, at least their ongoing communication. As we understand it, the plan is again, as I mentioned, hospitals are administering for healthcare providers, and that's underway and occurring across Dutchess. Nursing homes are getting their supplies distributed and delivered to them. Delivered to them through pharmacies, the pharmacy providers like CVS and Walgreens. That's underway. Will occur between now and within the first 2 weeks of January. And then secondarily, there'll be a next phase, which will include other essential workers established, again, by the states. The states determine that priority listing, and then public access is likely, now we have been saying March and April, which is basically what we're being advised, sort of general public access to vaccines and vaccination in March and April. However, I will tell you, the FDA did say, the CDC did say 2 days ago that it is likely that general public access may be sooner than that. And we're hopeful, but that is currently the timetable we're functioning from. John has asked if we'll report the number of vaccinations in the county. That is not something that we'll have ready access to. I think that you'll hear that from the state of New York. So as the state identifies percentages of those who are participating and taking advantage of the vaccinations, you'll get that information from the state. It is not something that will rest in county government. We won't have that data, and we'll certainly, the state will want to communicate at least basic data regarding vaccinations, because the goal is to get to a point where 80% of the public has chosen to take the vaccine. And now, mind you, I will again say in the state, while there is legislation that's been proposed, I think by a member of the New York State Assembly, to mandate vaccines, the governor has said that he does not support mandatory vaccines. I don't, and so our position will be to continue to communicate and to educate regarding vaccines and vaccination. I want to get to a couple. Let's go back to hospitals. HVNY has asked, Duchess peaked at 108 hospitalizations in the spring, now at 106. Is the surge flex plan sufficient as the trend continues upward? Well, if the trend continues at the rate that it is today with no plateauing, the answer is that's not sustainable. But it's a good question. So early on in the pandemic, we knew a lot less about the virus, and we also didn't have therapies that, we didn't know the therapies that were going to effectively keep people healthier longer. What our hospitals say today is that they understand the playbook a little bit better, and we are seeing people that are being hospitalized. They're not as severe. They're being maintained in a more stabilized way, and some of the hospitalization problems or that the length of stay in a hospital is much longer now than it was early in the pandemic. Two sad realities to point out. One, early in the pandemic, remember the state of New York issued an order that said nursing home patients could not be refused by a nursing home even if they had COVID. Remember, and again, that resulted in individuals with COVID returning to nursing home settings in a lot of locations and subsequently dying in that nursing home. That did mean that people were hospitalized but then returned more quickly. So the two realities that we need to consider for hospitalizations currently is that order has changed, right? That was reversed. So individuals who might come from a nursing home setting are not being returned, and therefore they're taking hospital beds for a longer period of time. Understanding that decision making, that's the reality. The other, of course, is that individuals are staying longer in a hospital setting and then succumbing to the virus. So that is something to pay attention to. So what I will offer to you is that Dutchess County, currently we talk about having access to about 425, 450 beds. That is with the understanding that at some point, if the rate of hospitalization grows, elective procedures would have to stop. The hospitals do not believe there will be a need for an alternate care facility. That surge capacity exists currently within our region's hospital bed system, including the beds that we know, the potential use of beds at the new pavilion at Vassar, and the sharing of beds at a regional hospital administered by Westchester Medical in Ulster County. Long answer to a short question. Currently, we do not believe that there is a need for any alternate care facility, that there is capacity, but at this rate, if it continues to grow without plateauing in the next several weeks, there would need to be some restrictions on elective procedures and other precautionary steps made at the hospital level. Currently, they're not alarmed, but and that actually, by the way, gets to June's question. Are Dutchess hospitals going to cancel elective surgeries? Short answer is not yet. And let's at least move to in addressing Michael's question, any parts of the county close to a yellow zone, and talking a little bit about those zones. So the state of New York altered the zone metrics and changed the framework. So instead of focusing on simply positive cases and the rate of growth, which was the framework, they are now measuring hospitalizations. So the new zones, there are no new zones in Dutchess, but the new zone framework, there are no zones in Dutchess, but the new zone framework is focused and has an emphasis on hospitalization rates within a total region. Because hospital beds are shared beyond counties, right, the state is monitoring hospitalizations and the rate of growth within the entire region. Now, I will tell you, if you want to follow those hotspots and where they are, you can visit COVID Hotspot Lookup covid.health.ny.gov. Talk about easy, right? COVID hotspot lookup.health.ny.gov. Now, the metrics are emphasizing hospitalization rates within the region. When a region gets to 3% positivity, that's the 7-day average, and of course that exists, right, over the past 10 days, and is in the top 10% in the state for hospital admissions per capita over the past week, and is experiencing week-over-week growth in the daily admission, you move to the yellow zone. Did you get that? Let's do it again. And you can see it here. So in order to jump to the yellow precautionary zone, that is 3% positivity, that's the 7-day average, over 10 days, and is in the top 10% in the state for hospital admissions per capita over the past week, and is experiencing week-over-week growth in admissions. Some of this data we have access to, right? We know the numbers of individuals hospitalized. We also know whether or not admissions grow week over week. We don't and can't tell you how the state is measuring this 10% of the state for hospitalization admissions per capita. But currently, we are not on the verge of a classification or designation for yellow. That is the yellow zone. Orange, 4%. You can go. You can see more of that data. 4% positivity, and in a region at 75% hospital capacity, or is deemed by the State Department of Health to have an unacceptably high rate of hospitalization. So again, some judgment decision making at the state level, which we understand. And then red zone is after canceling elective procedures and a 50% increase in hospital capacity, is 21 days away from reaching 90% capacity on the current 7-day growth rate. A lot of detail that we understand. I would say to you, it's not something that is going to be easily delved into or sort of projected. The data measurements that the state is using is just not something that's just readily available. There will be some judgment made, and that will be determined principally by the state Department of Health. We'll advise you when we feel as if we're headed in the direction of a designation. As of today, the state has basically said they would give as much as 72 hours advance warning. We are not on the verge of a zone, this new zone. This is not the old microcluster zone. This is now these measurement zones, in which with those zones come potential restrictions of activity. Long answer to a short question. Those are the details that they're using. So, Michael, no designated zone. We're not on the verge of a designated zone, but we are monitoring for those hospitalizations. Crystal, how long before high-risk people are able to get the vaccine? Again, the likelihood is that is end of February into March timetable, but that could be advanced based on what the CDC said 2 days ago. We just don't have an update yet in that regard. So, if you have a question, write down in the comment section below. Elba, is COPD high risk enough to get vaccinated? I'm not going to pretend to be that knowledgeable. I will tell you that is likely, but we will be partnering with some of our healthcare providers, and when the state makes clearer the next phase for public access of the vaccine, we'll bring some healthcare professionals online to answer those specific questions. I would venture to guess the answer is yes. But that said, I would much rather a healthcare provider give you that detail. And as the vaccine distribution program continues, as it moves forward, there'll be more detail, and that detail will get to you as soon as it's readily available. And we'll have the professionals talk about healthcare. I don't want to be in a position of giving. Somebody asked me yesterday, I think, would I advise them with a degree of high risk to get the vaccine? I am not the person to advise you. I think it is safe. I do understand the science as it's been described to me. I am comfortable getting the vaccine. I am not in line. I'm not a priority population. I'm not a high-risk population. But when that time comes, I certainly feel comfortable taking it. But that's a decision you should make with your physician and your family. And I don't want to give you that kind of advice, although I appreciate you thinking that my advice on that matter on that matters. No change in indoor dining capacity. So let's talk about what the state has done. Remember, the state did take steps to prohibit indoor dining in New York City. That does not affect Dutchess County, so there's no change in indoor dining. Restaurants continue to function or can continue to function at 50% capacity. Outdoor dining is still permittable. Obviously, I say that knowing what the weather is and knowing the challenges that exist. Although, we've sort of, I will admit, chuckled a bit. Some of the outdoor dining looks a lot like indoor dining, except it's in a tent. That said, those kind of facilities can continue to operate, and God bless those businesses that can make that work for them. But no restriction in indoor dining restaurants in Dutchess. We did get a couple questions about that. We would advise if that's to occur, although I would tell you that at this point, based on where we know the spread of the virus is occurring, that just wouldn't make much sense. And so we really want to hunker down and focus on you and I taking steps to protect ourselves. And the way to do that is to be aware of your health. If you're feeling like you've got some symptoms, if you feel like you may have come into contact with somebody who's had or has COVID, getting tested is appropriate. There are testing options, and as I said, there's efforts to expand that capacity, and that's underway. You want to engage in that physical distancing. You want to wear a mask, and you want to keep those gatherings small. And I understand, believe me, I understand that this pandemic is taking a lot from a lot of people. But if we can take those steps to protect ourselves, we can slow the spread of the virus. We won't see the great rate in hospitalizations. We won't see people get sick or die. And that's the goal, right? Limit that from happening. So no change in indoor capacity. Gyms, barbershops, and hair salons are not required to close if we end up in one of those zones. There are some capacity and testing requirements. We'll get to those if that's necessary. Currently, not in a zone. No change in dining, no change in gyms, no change in barber shops and hair salons. And hospitals continue today to expand their bed capacity as the state has asked for that to happen. The state's calling on medical professionals to step forward so we don't have staffing shortages and focused on trying to make sure that capacity exists in the hospital beds. I do want to, June's asking any information about children under 16 getting vaccinated. They were not included in the trial. The FDA has not permitted that to occur under their emergency order. As I understand it, there will be trials that include those populations, younger people and other populations. That has not occurred yet. FDA not giving emergency use authority for individuals under 16. Now, the good news is we haven't, again, obviously people under 16 can contract the virus, but we're not seeing the kind of spread or the same severity in younger people, in the youngest of people. I'm going to be careful. Certainly, we've seen it among young people, but the youngest of people are not seeing the kind of spread that we've seen or the severity that we see, except for underlying conditions. So at the moment, no FDA emergency authorization for younger people. That may change as the vaccine is distributed, but that has not occurred as of yet. Do you want to mention that the county is expanding our capacity at the Department of Behavioral and Community Health? We're including, we're hiring individuals to work in data entry, call taking, some of the rapid response, rapid testing. If you are interested, you should reach out to dutchessny.gov. We are hiring, these are individuals who work up to 30 hours a week, and candidates must at least have a high school diploma or a GED. If you have any experience in the healthcare community, in EMS, paramedic, LPN, CNA, RN, any of those healthcare positions with some background or training, you definitely we'd love to hear from you, so do reach out to us. Crystal, where can we get tested if we need to? CVS is backed up. Again, visit dutchessny.gov/coronavirus testing. Yes, you can get tested at a pharmacy. Most urgent cares have access to testing, so please reach out to a physician. You're really best, if you have a doctor, to try to reach out to that physician first. You can also, when you visit dutchessny.gov, you'll see that our urgent cares, healthcare providers, hospitals, in particular Westchester Medical and Mid-Hudson Regional, and several others have access to testing. We always encourage you to visit our website to link up to one of those locations. But yes, testing is overwhelmed and the capacity is limited across the country, but we do have access to testing. Just understand that in most cases you have to be screened. That takes a little bit of time. You then go to a test site or location. That's going to require a little bit of time as well. So you might be scheduled 2 or 3 days out. In some cases, you'd be scheduled even further out, depending on the location. And you may get to a test site and have to wait a little bit. In some cases, several hours as you're waiting behind others that are scheduled for testing. So. I want to remind folks again, we're seeing the cases in that sort of basic socialization. I mean, they've referred to it as living room spread. We don't need to make up new words. I would offer you casual settings. That's where we're seeing it, right? Where you're letting down sort of your guard, understandably. You're casual. You're interacting in a way that's a little less restrictive. That's where we're seeing the spread of the virus. Please try to limit that to the extent possible. Wear a mask, even if you're around friends and family, and try to engage in that physical distancing. Dr. Wythian, our Commissioner of Health, infectious disease doctor, I want to clarify. I don't remember Dr. Wythian ever committing that that animals could spread the disease, but rather that there was misunderstanding early on that perhaps it could rest, right? A sneeze or a cough could rest on the exterior of a pet, and as you're petting it, somebody had mentioned that. Dr. Wythian knows the science pretty well. It wasn't trying to disparage animals in any particular way. I read that and I was a little bit upset by it because I do know he tries so desperately to give good science-based answers. And I'll also say this to you out loud: everything we know about the virus, we have learned in the last 11 months. And so every time there was some other concern, there was new data, we try to provide it to you. What Dr. Wythian's been doing has been tremendous work, a lot of outreach. His updates this week, in fact, just a reminder he's out twice a week with that. He's talked a little bit about the quarantining and isolating. It's really important. If you feel like you've contracted the virus, you're not feeling well, or you know you have, wait. You don't have to wait for a contact tracer to call you to say isolate. You ought to isolate. And isolating means, by the way, if you're not feeling well and you're sick and your spouse isn't, as much as that becomes complicated, the goal is to isolate apart from each other so that your spouse can go off to work, your kids can go off to school, and you're not getting them ill either. So if you feel like you're sick or you know that you're sick, isolating ahead of waiting for a call or some contact is really a good idea. And so he's talked about it. We're encouraging you to do that. I do want to reference the state. So we say to you, start isolating. We say to you, contact those people that you may have had close contact with, and that you can return to normal activities after 10 days and no fever for 72 hours and symptoms have improved. So the isolating for someone who's contracted the virus, test positive, is after 10 days, because again, by the time you've tested, the assumption is if you test positive today that you will have had the disease, the virus, for several days prior. So you test positive, the expectation is you wait those 10 days in isolation, and if you've had no fever for 72 hours and you have no other symptoms and you feel improved, then you'll be out of isolation. Now, the CDC has changed, as you know, their guidance for close contacts. If you're a contact of a positive case in the state of New York, you must stay home for 14 days. That's it, by the way. There is no change. If you haven't tested positive, but you're a direct contact with somebody who has, start to isolate, stay home except for urgent medical purposes, monitor your symptoms, get tested if they develop, and you must be home and isolate for 14 days. The CDC changed their guidance to 10 days. However, the state of New York has not changed that, and local governments, county public health departments are required to follow the state guidance. That is still 14 days. And if you we ask that you follow us, right? Yeah, we'll try to give you some information. You don't have to wait for a contact tracer, but if you get a call from a number that says Dutchess County Government, New York State Government, New York State Contact Tracer, take it. Take the call. They're not going to steal information from you. They just want some basics. They'll talk through what those expectations are, and if you'd like, you can download the COVID Alert New York app on your smart device. Just go to the App Store and make that purchase if you wish. Again, it's a free download. Gets on your website, gets on your handheld device, and you can use that to be of some help as well. Alicia, what is the county doing to help K-12 schools stay open? Well, first of all, that's a decision the schools get to make, but we have been supporting our school districts since last February. We meet with them regularly. We have provided throughout this entire process the information, the basic protocols. We have a testing infrastructure if necessary to provide should they get forced into a closure requirement where testing is necessary. We believe we have the infrastructure to support that, but at the end of the day, school districts are governed by the state. They make those decisions. We support them. If they are open, we're conducting the contact tracing with them. We're providing them the tools to immediately initiate the isolating requirements. And as I said, we've expanded testing capacity should they need that with the necessity to test to stay open. But other than that, school districts get to make those decisions on their own. Most of the school districts that we've had have issues, their concern has been they might have a positive case, but multiple contacts, and those multiple contacts could be staff members who have to isolate for 14 days. There is nothing that can be done to somehow materialize a new staff member. So that's been the challenge. But Alicia, we're providing that assistance to school districts. We as I said, we meet regularly. We're having regular dialogue, and we're providing the support infrastructure to make sure that happens, so that they have the support necessary. We've talked a little bit about testing and the goal of again isolating yourself and monitoring your own symptoms and contacting close contacts. You can be a part of that process to keep people safe. What I'd like to do, if we don't have more questions yet, is jump right now to storm information. So I feel a little bit like a weather person. Here we have here we have the map. You likely know that there is a winter storm warning in effect until 1 p.m. Thursday, 1 p.m. tomorrow. This is expected to be a significant snowstorm, a good old-fashioned snowstorm that will affect the entire region. Current projections are forecasted for snowfall to begin late afternoon today into the evening, with accumulations of 12 to 18 inches across Dutchess County. We expect at times during the overnight hours that the rate of snow will be such that snow removal will not keep up with the rate of snowfall, and visibility will be significantly limited. So we want you to be safe, but also to be patient. And if you don't have to be out on the roads tonight and tomorrow, please choose not to be. I will tell you that our 911 system is fully operational. We're fully staffed and prepared, as we always are. Very grateful to those emergency dispatchers. Many times they get forgotten when folks reach out and acknowledge emergency responders. The critical link is always those 911 dispatchers, and we're very, very grateful to them. The County Highway Department is fully prepared. We've prepped and ready. We met this morning, as we do. We convene our supervisors and mayors with public utilities and the service providers in county government. We have activated and will have activated our Emergency Operations Center as of 3 o'clock today. That is functioning virtually under the current pandemic protocols. So all of the appropriate agencies are there and available 24 hours a day, 7 days a week, through the duration of a storm. We have Office for the Aging has delivered additional meals to seniors, so they're prepared. Those seniors that get meals from us are prepared in case we can't get out and distribute tomorrow. I do want to note that Dutchess Transit is suspending their service at 7 p.m. tonight through the end of the storm. To give you advance warning, 7 p.m. tonight, public transit will suspend service through the duration of the storm. If you have questions about that, please visit dutchessny.gov/public transit. We're comfortable with the hours. We are announcing hours of operation tomorrow. We're good to go. Wanted to be sure. So county offices will open at noon tomorrow. Services and essential services will still be provided, but we are not going to have county government offices open until noon tomorrow. So if you have an appointment or you're planning to come in ahead of 12 o'clock tomorrow, county government offices will be closed until noon on Thursday. All services, essential services, will be functional and be provided, and you should follow us here on Facebook, Twitter, or the county website for updates, and you can visit duchessny.gov for that. Lisa Marie, what are the restrictions when a state of emergency is declared? I love that question, so let me bore you to tears with State of Emergency 101, as we like to call it around here. I've sadly been doing this for too long that I almost get excited about this. First of all, a state of emergency declaration by the governor, by the county executive, by a mayor, have absolutely no functional distinction. Meaning, just because the governor declares a state of emergency doesn't mean that anything happens. What it means is, under the state law and under the New York State Constitution, the governor, county executive, city mayor, town supervisor, village mayor can declare a state of emergency. That allows us to mobilize resources without having to follow the same basic protocols, meaning the governor can take a resource, a plow truck, a response crew from Western New York and move it to the Mid-Hudson Valley. That declaration doesn't mean anything for you unless it is followed with specific emergency orders. And so, just because there's a state of emergency declared, which the governor, I believe, is expecting to declare today, that doesn't mean you don't have to go to work. It doesn't mean you need to be off the streets. All that means is he or she is able to move resources across the state to assist county responses, right, where the emergency response apparatus in responding to a storm. If I declare a state of emergency, it needs to come with specific orders. Sometimes that will be no non-essential travel. That order has the force of law. And, however, simply declaring a state of emergency does not mean anything unless it is followed by a specific order, and we would tell you what those orders are. As of this moment, the expectation is the governor will have, maybe he has already, declare a state of emergency for the counties to be most impacted. We would likely be one of them, enabling him to work with county governments through the State Emergency Management Office to move resources to our region to help us respond. Power outages, they might bring temporary traffic lights or staged lighting. So all of that is part of the declaration. And then secondarily, if there is a concern, you'll have a specific order. Get those questions all the time. And I will tell you, when we meet with supervisors and mayors, we say to them, please do not declare a state of emergency. Because if you do, people think that they shouldn't go off to work or they shouldn't be on the streets. So we coordinate all that with our supervisors and mayors. Very collaborative here, working with supervisors and mayors. And so if there is a specific order, we'll tell you about it. And following us on Facebook, Twitter, or our county webpage will provide you that information. I hope that you have been bored to tears with my explanation of states of emergency. But it is important because there's just so much confusion about that. And I will tell you this. If there's an emergency order, as I said, it does come with the force of law. So if the order is you shouldn't be out driving, that actually does have a law enforcement component in it. So and so be aware of that. But no order has been made yet. We do expect a state of emergency to be declared, and then with that will come specific steps. Okay, here we go. Justin, Cuomo stated, the governor stated, that Westchester Medical Center would be in charge of vaccines for the Mid-Hudson region. Does that mean the old St. Francis will be in control of vaccines in Dutchess? Not in control. The way this is working in stage one is a hub and a spoke. Westchester Medical Center at Mid-Hudson Regional, so that's the old St. Francis, will be the hub for healthcare vaccine administration in Dutchess County. That is not for everybody all the time. That is right now Westchester Medical state designated hub for vaccine distribution for the medical staff. That is the federal government, right? It's through Operation Warp Speed. The federal government has worked with these providers. Vaccines have been distributed to the states. The states designate centralized locations for Dutchess County, for the healthcare community. Currently, that is Westchester Medical. Nursing homes. Nursing home staff patients will get vaccines distributed and administered by several major pharmacies. They've selected those, underway. The next phase, other essential staff, what have you, may have to access the vaccines through Mid-Hudson Regional, but others will at some point have access. Vassar Brothers will have access. Caremount will have access. So again, as the phases unroll and sort of play out, other providers will have access to vaccines, and you and I will be able to have multiple locations potentially to get those vaccines. But currently, Westchester Medical, Mid-Hudson Regional, the old St. Francis, is the central hub for vaccine distribution for healthcare providers. That is what is occurring currently. Lorena, what are we doing to mitigate the obvious rise in asymptomatic spread and COVID fatigue in the area, seeing higher peaks now than first wave? It is true that we are on pace to have more hospitalization and more cases. As I mentioned, the hospitals are not pointing to a more severe, a greater severity in the hospitals, but sadly there are people who are there who need that hospital care, and that is the challenge we face. What are we doing? We're calling on you and everyone else in Dutchess County to adhere to those basic protocols that we know work. Wear a mask, physical distance, keep social gatherings small, and limit those activities to the extent possible. This Christmas, I will be celebrating with my 4 children, my wife, my mother and stepdad, who have been living in my house for several weeks until they leave the state of New York to go to Myrtle Beach in the new year. I'm not saying that it has to happen anytime soon, but it will happen, and that will be it. We usually have my brother and their family over. We're not doing those things, and we're asking you to do the same. Listen, we've all been through a lot. Businesses have shuttered their doors. Families have been broken apart. There are people living in isolation in nursing homes. We all understand the challenge. Many have lost loved ones. I know this. It is just so critical that we continue to follow those basic protocols because we know that they work. And if you do those things, we'll slow the pace and hopefully flatten that hospitalization curve. But we are on pace, as we are throughout the state, throughout America. You are seeing increased cases. You are seeing increased hospitalizations. The goal here is to not have that rate of growth extend too long, to save and protect lives, and hopefully that meets this light at the end of the tunnel, if you will, for vaccination, and we get to a point where we've controlled the pandemic a little bit more. Maureen, can you explain the per capita formula that is part of the yellow-orange zone classification is based on population density? Okay, can I? Not easily, but I will tell you what we know, and then we'll explain it. Again, in order to be designated the zones, you see that above me here. 3 yellow zones, 3% positivity, exceeded that, and this per capita over the past and is experiencing week-over-week growth. So the short answer is hospital admissions can be measured per capita, right? So depending on the number of hospital admissions divided by the total number of population, that gives you the per capita admissions. I won't do the math with you, but that is what gives you the per capita admissions in a region. However, the state is measuring that against the total admissions statewide. And I think to the extent, I don't have an easy way to explain this, but to the extent it makes sense, right, is we're monitoring the total admissions in the region because we share hospital beds. So throughout the region, if we needed to move folks from one hospital to another, that can happen. So admissions per capita in the region gives us an understanding of at least the rate of growth in our region as it relates to total population, and then how that compares to other regions. Because if we're below and past that rate of growth, right, we're seeing high rates of admission, and some other region is seeing some high rate of admission, you'll end up with not having capacity anywhere. But perhaps one region's accelerating above faster than another. The goal will be to slow down the growth in that region so that we don't have a total explosion of hospitalizations across the state. The short answer to your question is no, we can't easily explain it. What I can tell you is that we're monitoring hospitalizations versus the total bed capacity. Dutchess County has about 450 beds, but that's part of thousands of beds in the Mid-Hudson region. And we measure that against new admissions against total population in the region. And we are benefited to some degree, and we talked about this early on, we benefited to some degree because we're in a very large region, meaning that there are more beds available to us, and the total population does dilute individual cases and caseload if those numbers are manageable. All of that said, we're measuring hospitalizations versus capacity, admissions versus total population, and how that compares to other regions. The state of New York will tell us if we're in that top 10%, if we've exceeded the 75% capacity thresholds. Those are all to be determined by the New York State Department of Health. I'm sorry that I don't have an easier way of explaining that, but I tried my best right there. And we'll find out in a moment if anybody thinks I did at all a good job in explaining that. So let's talk a minute again about that storm. Returning to that, we are expecting 12 to 18 inches. We're expecting that to begin later today. There will be rates of snowfall that will impact visibility, some wind, and we do expect there will be moments where just snow plowing is not going to keep up with the snowfall. And so at some point tonight, you're going to go on Facebook and you're going to say, they're not plowing my street. And I will tell you that that may very well be true. In some cases, there's a science to it, meaning in some points it's just not safe nor logical to try to plow as the snowfall is coming down faster than we can keep up with it, meaning public highway crews across the region. At some point, they'll monitor to see, by the way, if there's icing and buildup, they may scale back in order to create a caking, if you will, so that there's some traction. And the other reality is these crews are living under the same restrictions you and I are living under. So they're limiting the number of people that are out at a particular time, and in some cases you have highway departments and public works crews that have staff that are isolated and therefore can't come off to work, or we don't want them to under the current circumstances. So please be patient. This is the second time it's snowed during the pandemic, but the first of really a true traditional winter weather event during this pandemic and these restrictions. So please be sensitive to that. Please be patient about that, and please be safe. I want to remind you, county government offices will not be open until noon on Thursday. If you have a DMV appointment, if you have a Department of Motor Vehicles appointment between 9 and 12 on Thursday, those appointments will be the same time scheduled on Friday. So they're moving the Thursday 9 to noon appointments to 9 to noon on Friday, and please be aware of that. The county clerk is working toward that, and again, county government buildings services will be underway and effective, but offices will be closed until noon. Okay, so Sarah, how are you helping employers encourage staff to get vaccinated? Great question. First of all, it is by choice. Remember, employers, in particular the healthcare community, they're doing a pretty good job starting that communication effort. We are explaining the science. We're explaining the science. So what you're going to hear from us is, so a couple things are underway. Number one, we are as aware as we can be of the distribution timetable and how vaccines are being administered, so we can communicate with those groups of people. Our staff meeting with nursing home staff regularly, communicating with them back and forth, speaking to their concerns, relaying the efficacy of the vaccine. Same in the healthcare community, meeting with healthcare providers, major healthcare providers regularly. We're going through the science and the desire to have essential staff vaccinated. Secondly, we're coming to you. We're working our teams, communications teams, with the hospital communications teams, healthcare providers, to get you experts in the field, professionals in the healthcare community, to answer your questions. I readily admit that I believe I'm trustworthy. I think that you have come to be confident, at least in most of the information we provided you, but I am not comfortable, nor should you be comfortable, in a politician giving you healthcare advice. We can tell you what we know, and you digest that information, but over the course of the next several weeks, you'll start to see healthcare professionals interacting with us on these calls, on these town hall sessions, and we'll be doing outreach through town hall meetings. We'll do outreach through social media communication. And again, the goal here is to give you what we know, and then you make that decision. I believe in the science associated with the vaccine. I believe that it is safe based on what I have read and what I have digested. We want you to digest the information to make those decisions for yourselves, but we want you to be able to ask questions about the makeup of the vaccine, dispel some myths. I will tell you, I follow the Mayo Clinic online. I share some of their daily factoids. I think it's useful. Again, it's always a link. You can find out, read a little bit more. You're going to hear a little bit of that. We're also working on a collaborative effort to do outreach into the community. You'll be hearing more about that, so that we'll have a good grouping of stakeholders that represent the community, working to educate and communicate the efficacy of the vaccine, the value of being vaccinated, should you wish to be, and where you can get questions answered. That's all going to happen over the course of the next several weeks. Today, right now, and over the course of the next 2 weeks, Only healthcare professionals, only those in nursing home settings will have access to vaccines. We're communicating regularly with them. They're communicating with their staff, and there'll be an outreach effort to make sure that happens. As we move to more public access, we'll have more public-facing communication. As I said, we're devised a really, I think, relatively good plan to help educate healthcare professionals online, answering those questions, and an outreach effort to members of the community. Maureen, thank you for thanking me about that cluster explanation. I tried my best, I really did. Michael, will schools reopen after the new year? The goal is to have them reopen. The governor has stated support for getting schools to reopen. We are supporting our school districts to the extent we can with resources. Again, the way the states changed the framework, they actually, this cluster framework, assuming we don't exceed those certain, into those zones, schools should be able to open. They should be able to function with some restrictions, mostly these hybrid models. I certainly think that it is best that young people be in a structured environment. And again, we weigh the closure of schools and students not being in a structured environment versus where would they be otherwise? Are there daycare providers that are available? Do families have the capacity to provide that help? And based on where we see the spread of the virus, it's occurring in less casual, in more casual settings, not in the more restrictive settings like a school setting. So again, all of that will weigh into decision making, but our goal is to support schools with the information, the resources they need to remain open, and we believe that we can do that. And again, that decision is on them. Deborah, have you gotten vaccinated? I am not a priority employee, and I know that sounds kind of funny, right? But under the current provision, healthcare providers are first, nursing home patients and staff are next, emergency medical staff and first responders, essential staff, and then public access. At my time in that schedule, I intend to get the vaccine at that time, but I am not jumping in line. There's nothing about me that makes me more important than a healthcare provider getting access to that vaccine, and we will keep you apprised of what we're doing and how we feel about it. Now, I don't speak for my wife. I don't speak for my kids. They're not public officials. I'll tell you what I'm doing. When it's accessible, I am likely to get the vaccine, but I will certainly keep you posted on my own decision making and how I feel once and when that does happen. There are questions regarding the vaccine and if you have allergies. I do know that the basic advice is what they're saying here in America is if you have allergic reaction to the basic components of vaccines like this, you may want to hold off. We'll talk at some point with professionals who can talk a little bit about the ingredients, if you will, of these vaccines. But I think the general consensus is if you're generally have an allergic reaction, you should consult with your physician and make that determination. They are seeing, and again, I'm telling you what we're being told today, they are seeing for those who have sensitivity to vaccines that there are mild allergic reactions that subside shortly thereafter, but we'll monitor that and we'll explain to you what we know when we know it. Okay, let's jump to some other information. We'll talk a little bit about the rail trail. Some good news, the Harlem Valley Rail Trail. I love these photographs. Who took these pictures? Sue O'Neill, and so the Parks Division took these pictures. We have great people working communications and parks. I love these pictures. The Harlem Valley Rail Trail is the oldest rail trail in Dutchess County, the former rail line, Harlem Valley Rail Line from Wassaic and eastern in the town of Amenia into Millerton. We have completed the expansion into Columbia County. You can walk, hike, bike, and soon snowshoe and cross-country ski right up to Copake. Open, operational, enjoy it, take advantage of it. Even though it's a little cold out, great to get out there. Beautiful rail trail that cuts through the Harlem Valley, through the village centers, through the farmland, into open spaces and great views like this one. So please take advantage of it. Tomorrow, sledding at Bowdon Park begins. I like to take credit for this. We did not have sledding at Bowdon Park in recent years until I became county executive, and I will tell you that I like sledding so much. Oh, am I going to get a phone call? I like sledding so much, I demanded that they get sledding going again. So we have sledding at Bowdon Park. It's a blast. Based on my experience, just be ready to move fast. That hill is steep. The sledding is quick, and we do set you up so that you if you don't stop on your own, you will be stopped before you hit the train tracks in the Hudson River. But please have a lot of fun. Ice skating rink will be open soon. Not yet. Skating is.
Temperatures aren't.
It's not cold enough. So. Not cold enough long enough. Cold enough today, but not cold enough long enough. We'll have the ice skating rink open soon at Bowdon Park. I'm sorry, I'm losing it. But sledding at Bowdon starts tomorrow. You'll be able to ice skate sometime soon. The rail trails are all open. Take advantage of those. If you get down to Bowdon Park over the weekend, story, walk, and holiday music at Bowdon Park, really great. Bowdon Park, the story walk, we're still Saturdays and Sunday, December from 3 to 5 p.m. Look for the signs. There are big signs. Somebody said they didn't see them. I went down there yesterday. I saw them. This is provided in partnership with the Poughkeepsie Public Library District. Great time. Just walk through there. Of course, the Great Snowy Day book written by Ezra Jack Keats in larger-than-life format. You can walk through the park, listen to music in the background during the holiday season, piped out through our chapel at Bowdon Park, and that's on the weekends in December from 3 to 5 p.m. Sorry, jumped off a cliff on that one, right? 3 to 5 p.m. on all of those. No cost for sledding, no cost for walking, no cost for the music, no cost for hiking the rail trail, no cost at the parks. Just go enjoy. Are there any other questions before we close up? I think we've covered basically all of it. I'm sorry at the end I got a little punchy, but it's been a long day. In the meantime, though, snow we expect to start later this evening. Be safe tonight, as I mentioned. There will be moments where plows will not keep up. There will be a time where plows will just get their crews off the road, get them rested up. You will look out your window and you will say, they did not drive by and plow my street. The likelihood is at that moment that is true. And then they'll get right back at it. In the meantime, those public works crews have been working hard to prepare. They'll be out there. 911 dispatchers ready to go at 911, and our emergency operations center is functional with all the appropriate agencies. Supervisors and mayors fully prepped and prepared this morning. And I do want to acknowledge our emergency responders. Remember, in these times, it's a little more stressed for police to respond, for emergency responders to get out there. Please be patient with them. Please be sensitive to that. And please be aware, if you are out on the roads, keep your eyes open, be alert. And be sensitive to those others out on the road. I want to thank our tow companies, those tow truck drivers out there. Believe me, they come in handy during these times of year. Be safe while you're out. Don't be on the streets if you don't have to be. And in the meantime, stay healthy, keep strong, and be kind to each other. Thanks.